Dear friends, we have the challenges. The topic is the challenges that can be posed in treating the heart failure in a developing country and the importance of registry. We know, dear friends, that about 40 million people have heart failure worldwide and about $100 billion are spent on heart failure treatment and 2 million rehospitalizations per year occur. And 1 in every 33 will have heart failure in 2030. That is the prediction that has been found. So this is because of the exponential growth, urbanization, so many things. But do we have a real data in India and developing countries? Actually, there are some data that are coming, but these data are mostly in acute decompensated heart failure and in some of the patients chronic heart failure. This is because of the many states, many languages, varied cultures, different socioeconomic status. So there are so many challenges. Lack of education, lack of adequate follow-up, poor drug compliance. So these challenges, we have to meet, poor follow-up, all those things we have to meet means there will be, to cope up with these challenges, the one and only solution will be a dedicated, comprehensive, well-programmed registry. There are different registries throughout the world. One is Inter-CHF study, which showed a comparison between the developing and the developed world. And they found that in developing world, it is the patients with heart failure are much younger, more symptomatic, more often treated with digoxin and had little education, low rates of health insurance and more from rural area. And the mortality was also very high in these patients of India and other developing countries. Another study called as Asian HF study showed about 5,276 patients throughout in the 46 centers throughout the world, and they showed the inter-regional differences in the treatment pattern. Our own registries, say for example Trivandrum Heart Failure Registry and NHFR Registry from which was funded by ICMR, they also showed that the ischemic heart disease is the main etiology for the heart failure in developing world. With all this, we did actually Indian College of Cardiology, we did with under Dr. Manjunath and Dr. P.B. Jayagopal, we did one study called as ICC NHFR study, wherein we studied about 5,000 plus patients and in 2 phases, and these patients again showed that ischemic heart disease was the most common etiology. The diabetes, hypertension, CKD, COPD and CVA were the comorbid conditions, and when we see the treatment pattern, the diuretics were more commonly used, but the ARNI was not much used because of the cost factor. And henceforth we have to see, really we have to follow up with the registry whether the ARNI is more prescribed, because the cost of ARNI is coming down in India. Now the device therapy was very less, say for example 1.5%, and the in-hospital mortality was 6.9% and 1 year mortality was 20%, which was comparable to other registries. So whatever it is, there are a lot of difficulties ahead, but we have to take these difficulties as opportunities and we have to make the treatment possible for the developing world. And finally, the heart failure care in India is dependent upon a team effort. Team effort is very important, and this team consists of the heart failure specialist, that is cardiologist, the psychologist, dietitian, pharmacist, heart failure nurses and heart failure coordinators to monitor the care. In fact, in ACCHA statement in 2022, one statement has come, with all this team effort, the heart failure mortality has reduced from 20% to 9%. So the team effort is very important, because it is not I, it is we. I means illness, V means wellness, and the different solutions for the challenges in treatment of heart failure in developing worlds could be, one is the registry, which can be funded by different organizations, and improving the patient follow-up, improving the physician and cardiologist follow-up, because we have to go on talking to the physician and cardiologist to get the data. And early diagnosis and treatment, very important, because early diagnosis is possible with NT-proBNP, so that we can do the early treatment And improving the device therapy cost is an issue, but nevertheless we have to try it out. And improving the healthcare infrastructure, say for example, heart failure clinics can be established. Another one is the genetics, the cultural and environmental factors also have to be taken into consideration. Last but not the least, the primary prevention of ischemic heart disease, the diabetes mellitus and hypertension, because ischemic heart disease is the most common cause of heart failure as we know. So this treatment of IHD, diabetes and hypertension will reduce the prevalence and incidence of heart failure so that the management will be better. Thank you so much.